I have some technique tips that I think I've found valuable. In treating laryngeal papillomatosis, I often like to inject Röntgen space with some form of fluid. I will occasionally use saline with a small amount of epinephrine, approximately 1 to 100,000 epinephrine. I may also use cidofovir in Röntgen space if the patient and I have agreed ahead of time to use cidofovir. If this is not an FDA-approved use of cidofovir, however, I will often then, once I've injected the space, I will then shave the tumor or the large or bulky papillomas from the vocal folds. In those settings, I will use usually a line setting with a digital AccuBlade, removing the bulkiest components of the papilloma. Once I've removed the bulkiest components and I have a relatively thin sheen of remaining papilloma along the vocal fold, I will often use the laser in a round spot scanning mode. And this I will use anywhere between 1.2 and up to 3 millimeter spot size, depending on the size of the remaining papilloma, and then treat very superficially up to the basement membrane, trying not to violate into the lamina propria. I think that technique has been very helpful in both eliminating very comprehensively the disease, as well as providing and preventing scar tissue formation that would cause further hoarseness, even in the absence of papilloma. For other procedures, I have used the digital AccuBlade with a line formation for treating Zenker's diverticulum. I find that a line provides a very nice and near continuous depth of dissection through the cricopharyngeus muscle and into the cervical esophageal muscle. I think that allows division of the cricopharyngeal muscle fibers completely and identification of the fascia of the cricopharyngeus muscle beyond. Once this is completed, if the patient has a very small diverticulum, often no further dissection is necessary. I can change the length of the line, and I may start it at a 4 millimeter line and bring this down to a 1 millimeter line by the end of the dissection as we get to smaller and smaller amounts of tissue for division. These are the ways in which I find the CO2 laser to be helpful in particular situations.